Welcome back to Higher Ground. This is, yes, it's Kathleen, ringmaster of Higher Ground. One of the things that I really am enjoying about the virtual summer camp this year is we're able to delve a little bit deeper into career tracks. And by this, I mean, whenever I talk to someone about their career, they're thinking that they're just going to do pen testing or they're just going to do, forensics, but they don't actually look at the specific industries. And there are so many industries that overlay into security. So today we're really going to talk to two of my dear friends in the community who have been ankle deep, eye deep, over their head into healthcare. And what's really interesting is that they've overlaid not only their security backgrounds, but their privacy backgrounds, and really opening up the door to what kind of careers that you can look at being a security professional and helping the healthcare industry. Welcome to BSides Las Vegas 2021, the virtual edition. This is Yes, it's Kathleen, and I am the ringmaster for Higher Ground, one of the tracks here at BSides Las Vegas 2021. We always focus on career search and career development here in Higher Ground. Over the past few years, we've really focused on search techniques, understanding hiring managers, and really understanding yourself as you're going into career development. This year, we wanted to focus a little bit more on some key industries and what you need to do to get involved with specific industries in information security. I am honored and pleased to be joined by two of my colleagues who focus on healthcare information security and have them share with us some of the things that they have encountered in developing their career within healthcare information security and their recommendations to you if you want to move into this new field. So I'd ask my panelists to introduce themselves. Suchi, you want to kick it off?
Sure. Hi, my name's Suchi Pahi. I'm a data privacy and cybersecurity lawyer, and my specialty is in health technology and healthcare. I've been in the field for quite a long time, according to me, but I think it's like a decade. Or maybe 13 years. Anyway. So I've been around, seen a lot of things in the traditional healthcare and then health technology and the disruptions and stuff like that, and worked with some amazing security folks and worked with some folks who are really on the trajectory to being amazing. So I'm really looking forward to this conversation and sharing what I know with y'all.
And Mike Murray has always been part of Higher Ground, really sort of focusing on career development for mid-managers. So I'm really excited to put him more on the spotlight right now, focusing on healthcare. So Mike, your introduction.
Thanks, Kathleen. So thanks, Kathleen. And I know you know, but I'm always excited to be a part of Higher Ground and speaking to this audience. But you're right. This time we're talking a little bit about something that's in my wheelhouse. So for those that don't know, I'm the CEO of a company called Scope Security, which is a open XDR platform that services only healthcare delivery. We sell to hospitals and health systems and people who are delivering care. And I came to healthcare a long way into my cybersecurity career. Unlike Suchi, who sort of started in healthcare, I started out as a hacker, pen tester, vulnerability researcher back in the 90s, and have worked all kinds of places and ended up coming to healthcare later. I ended up, after I exited the last company that I started, which was called Mad Security and the Hacker Academy. It's actually two companies, but long story there. Ended up through a bunch of serendipity taking over pre-market medical device security at GE Healthcare, and walked in the door and learned that really security people don't know anything about healthcare. And I was sort of patient zero in my own experience, that I was the person walking into these rooms talking about things that security people knew and realizing that that didn't necessarily work with how healthcare actually worked. And so got really into understanding what our customers were going through, and eventually decided that somebody needed to go start a company to solve some of their problems, and ended up being me. And so here we are. But really looking forward to this panel and to all the conversations we have.
So we have two different trajectories going into healthcare information security. So Suchi, take us back to when you first started thinking about getting involved in healthcare, and share your career path a little bit more detailed so that people can see the trajectory that you've taken, and what really interested you in going into healthcare information security.
Yeah. Mine is kind of random. So I like to say that I just fell backwards into my career. And I think this might resonate with quite a few folks who are thinking about healthcare security. So in university, I was studying to be a doctor. And then I took a health policy class and I realized that there was a lot of information that was lacking on data privacy and data security from folks who were really established in the health policy field. And so they just didn't have a good grasp of technology and what it really meant for health privacy and security going forward. And so after taking that class, I did a brief stint in health IT, which only confirmed everything I thought was going on when I was in the health policy course. And so I went to law school, I focused on privacy, and because I'd been working in the healthcare IT industry before, it was easy for me to decide to just specialize in it because I had all of the background knowledge I needed to understand the healthcare industry itself and who needed to send data where and why they need to do it and what was more important. And that's what I've been doing for the past several years. And then I moved into health technology, which has been an interesting experience that I'm sure we'll touch on later, where it's navigating folks who really know technology, but who really don't know security or healthcare and getting them on the same plane. So.
And Mike, you mentioned a little bit earlier about, that you were at GE Healthcare, but, sort of again, share your career path, what got you interested in healthcare, and what were some of the milestones throughout your career that led you to starting your own company?
So I knew I was going to start my own company. I started my first company at 19. That had nothing to do with technology. I put myself through college teaching kids how to play hockey. I'm Canadian, and so hockey sort of is a thing with us. And so starting a company was always just things that I did. My dad's an entrepreneur, and it just was a thing that was always in my kind of DNA. But specifically around healthcare, it's such an interesting journey for me because what I really learned when I got to GE was just how little security people, and Suchi just said it, but I'm going to show my own ignorance by telling some of my most embarrassing moments of my early time at GE Healthcare. Security people don't understand that healthcare is just different. I will never forget, I'd been at GE maybe 6 weeks, and sorry, I got, can we edit this part out? Let me pause for a second. I actually went down a road and then I was like, nope, I want to tell the GE story. And then I'm coming back down the road. Sorry, got mixed up there for a second. All right. So I was about 6 weeks into my time at GE and I was sitting in a meeting and we were reviewing a medical device and it's designed for security. And I asked about authentication. I said, okay, what's the authentication and access control strategy for this device? And the designer of the product said, we don't do authentication. And I said, as every probably person watching this would, that's not a good thing. Like we need at the very least usernames and passwords, but it probably needs to tie into the enterprise SSO strategy and like, where's your authentication? And I pretty much monopolized this meeting talking about the lack of authentication on the device. And then we left the meeting and this sort of older, gray-haired, long ponytail, old biomedical engineer pulls me aside and he said, Mike, you don't get it. That device is only going to be used in an operating room or in an emergency room. Do you want the doctor to forget their password if you're the one bleeding out on the table? And I went, oh, all this stuff that I know from all the other things that I've ever done, maybe they don't apply here the same way that I expect them to, so I should start to learn about how these people work. And that was really where I started to really become kind of a healthcare person, if that makes any sense. Because that's the moment where I realized that maybe security people don't have all the answers and we should go listen to the people in our business.
So that really delves great into our next question, which really talks about what was your technical and non-technical background, and how did that help or hinder you as you moved forward in your career? So I'm going to have you, Mike, sort of carry on with that, and then we'll move over to Suchi. So can you sort of expand a little bit more about the technical, non-technical background and what you saw helped you in your healthcare career, and what sort of was a hindrance?
Yeah, so I was always I've always been a bit of a generalist in that way. I'm pretty good technically, and I started out as a vuln researcher writing exploits. So I have a certain level of technical depth. But somewhere early in my career, and you've seen me talk about this at other BSides Las Vegas Higher Ground talks, but I realized that if I wanted to be successful at a broader level, no matter how great an engineer I was, it was always going to be better if I could get teams of people to do things for me and realize vision that way than that I would ever be a good enough engineer to do those things on my own. So I started developing those skills early on of management and leadership and understanding the business and all of that sort of thing. And when I got to healthcare, it was so important that I had those skills, because I realized that we as an industry, like if you really think about the security industry and the evolution of it, the majority of what we started doing was securing banks and financial services and the like. And the practices in financial services and the government have always been sort of assumed that those will work anywhere, right? Well, banks do it, that's the best security there is. Or, DOD does it, or the NSA does it, that's the best security there is. So we should be following that model. And unfortunately, a lot of those technical skills are great, but they have to be modulated for the business, right? What works on an oil rig doesn't work in a hospital and doesn't work in a bank. And until you're able to engage with that business and apply those skills in a new context, it's really hard to move into a very specialized industry. And so I was really lucky to have some of those skills. And I was really lucky to have some mentors, especially inside of GE, who were willing to take me aside and say, you need to re-examine your assumptions, and you need to apply these skills in a different way to this industry that needs unique things.
Great. And Suchi, when you were sharing your career path earlier, you were really talking sort of, you did some IT, but you also were working more on policy. So can you sort of expand upon about, how much of the technical background you used and how much of the policy background, and which sort of shaped where you were going next with your career?
Yeah. So I've always been a little bit of a curious person, and that's really helped me out with technology, because I'm not a technical expert. And as a lawyer, I rely pretty heavily on my technical experts or team members to make sure that I have risk analyses correct, a full understanding of the situation. So it's really a partnership between me and the security team or the engineers or whomever I'm working with who's more on the technical side. But I had to have at least a basic understanding of several things, like what the data formats are, why we would be exchanging data in certain contexts. And something that Mike touched on that's interesting to me is the idea of the financial industry being sort of that was the barometer for security. Whereas as someone who's been grown in the healthcare industry, I would never, even in the legal privacy world, I wouldn't say that, hey, I've done healthcare, so I can definitely also do financial industry. Like, I couldn't do that because I'd have to go in and read all of the regulations, figure out what the definitions really mean, all of the case law, and then find out what the nuances are from partners who've already worked in the field or people who've already worked in that specific financial field. So that was, Mike, by the way, super fascinating to me.
Ooh. Can I tell a story? I was talking to a healthcare CIO that said that one of the vendors that we all know, one of the big vendors, came in to sell to him and sell him security products. And the sales pitch of the person that walked in the room was, and I quote, this is a direct quote from this healthcare CIO, "We work with all the big banks in the world. They're better at security than you are. You should work with us." That's the way that we treat healthcare security executives as an industry.
Ooh.
It just doesn't work. It takes like the entire patient, provider, hospital to hospital. I mean, there's so many arrangements that suddenly exit that scenario. But I guess so, to really address the question, Kathleen, I didn't have a strong technology background. Like, I didn't train in it. I was a neurobiologist and a political scientist, and that was my undergrad. And then I went into health policy work because of an Obama initiative and learned how to implement electronic health record systems. And that meant reading through a lot of manuals, asking people who were actually in cybersecurity questions, and getting an understanding for the field. So I didn't need a tech background to get into health data privacy and cybersecurity as a lawyer. However, it has been incredible working with the newer lawyers in the field who do have that technology and security background. So if we had more, born and bred technologists who are moving into the policy, regulatory, lawyer space, then it would make my life easier, or the general counsel's life easier, or the CEO's life easier. So I encourage folks to get into this field.
Wonderful. So one of the things that we always hear when we're doing a presentation about careers and career trajectories is the education and the certs. So let's talk a little bit about what are the certifications that you think you need to have in this or don't need to have, or what is some of the community involvement that you need to do to sort of advance your career, give yourself a really good foundation. So Suchi, you want to kick it off with that?
Yeah, and I would love to kick that off. So I have a rather poor opinion of certifications, and I will defer to Mike on security certifications specifically, because I don't have knowledge of how hiring works from a security perspective for a security team with certs. From my perspective, if you're pursuing a cert, and I don't know of any that really will get you into health security, it's better to just learn about basic things like what is protected health information and what is HIPAA, who does it apply to. After that, you'll learn the rest of it in your job. And ideally, you would learn all of that on the job anyway. So for me, certs don't mean anything. They're typically an amount of money that's taken out of your pocket for someone else's pocket, and you don't get a value add out of it.
And Mike, what do you think about various different certs, or what are some of the things that you would recommend people be involved in other than?
Yeah, I'm going to get myself in trouble here. I always love when we're recording these, and I have to parse my words carefully a little bit. One of the last company that I started, we did a lot of training, we did a lot of certification work, and I actually agree with Suchi completely. I'm not a huge cert fan, and especially if you want to get into healthcare security. I think it's actually, I mean, we know that ISC Squared has their CISSP for healthcare. I don't remember what the exact acronym is. You can tell I don't have one, and it's not something that I require to come work at Scope, because honestly, I think Suchi got it right. Like the rules for security are pretty much the same everywhere. It's really how do you apply it to the business and how do you understand the business? And to me, there's two things driving the healthcare security market. One is healthcare security talent is really hard to find. And almost every CISO or CIO that I talk to in healthcare is desperate for security people who want to work in healthcare. So it's not like, you're competing with a huge number of other people who all have the same credential. There's lots of opportunity if you want to work in this field. You just have to be willing to. And the other side to that is how do you get good at it? Right. And it's not by going and reading some book and passing some multiple choice test. As Suchi said, it's about immersing yourself in their business. The groups that I would look at is less the security folks, right? I spend a lot less time talking to ISC Squared than I do talking to HIMSS. For those that don't know, HIMSS is, and I don't remember the acronym off the top of my head, but actually this year it's really interesting. HIMSS is actually in Las Vegas right after Black Hat and DEF CON. So I'm actually flying out there to go to DEF CON. And we'll be at DEF CON, Friday, Saturday, Sunday, and then HIMSS Monday through Friday the following week. So if anybody wants to be in healthcare cybersecurity, stick around an extra couple of days if you happen to be on site. And I guarantee you there's lots of opportunities at HIMSS. But HIMSS, there's a group called CHIME, which is the Association of Healthcare Executives. There's a group called the ACHE. These are the real healthcare industry organizations that will teach you how healthcare works, and to understand, like what Suchi was talking about. You can tell when somebody's in healthcare when they say payer provider, like it just comes out of their mouth really easily, and then you realize that there's a lot of people who don't know what that means, right? And that payers, and especially if you're not from America, payers and providers is a divide that really only exists in this country. Because payers is what we call is what we mean by health insurance companies, and providers is healthcare delivery, hospitals, doctors' offices, things like that. But those are the things you have to understand when you walk into healthcare organizations and talk to them about security. If they start saying the 18 factors of PHI and your eyes glaze over because you don't know what the heck they're talking about, that's what's going to make you successful at your job, much more than some certification.
Yeah, and I have to. Sorry, Kathleen. I was going to give a plug for HIMSS. When I was in health IT, it was indispensable because you could go and meet the folks who were involved in cybersecurity in the healthcare world. I think it's like Health Information Management Security Systems or System Standards, something like that. And so they have chapters everywhere. So you can get involved, get to know the players in the field, because the field is so small, you'll know everyone in it within like a year. And it's really helpful. Everyone's very helpful. The healthcare industry is generally a collaborative, collegial place to be.
That sounds great. I know a lot of people who would be very interested in being part of a collegial environment that's, protecting the security and information security of patients and doctors and nurses. When we were all talking about this earlier, we sort of were coming up with that this is very mission-oriented career path. That, in one of my previous careers, I was involved in nonprofit fundraising and marketing, and I thought that I was supporting a mission. And yes, it was a mission, but it wasn't a mission that I sort of felt that changed the world. But when the three of us were chatting earlier, we sort of talked about the mission of healthcare information security. So I just wanted to have the two of you sort of talk about, how do you become successful within healthcare information security, and is it really tied to a mission? So, Suchi?
I think being successful in healthcare security means being open to continuously learning, being aware of the context, and then being very, very creative. And I say that because a lot of times the medical industry does certain things a certain way when it comes to data and security. And if you're working in healthcare security, you have the opportunity to say, hey, we can do this in a better way. But to be able to say that without coming across as some like young, stubborn upstart from another part of the healthcare or another part of the security industry, you really have to understand the industry and what they're trying to get to and who the end client is, because the end client is probably not the person you're working for. The end client is going to be the patient.
Right, that's great. So, Mike, a little bit more about how to be successful in this industry, and is it mission oriented? Is it semi-mission oriented?
I think it can be. I think it really depends on where you are and what drives you. So, I mean, Kathleen, you know me. I'm very mission oriented, right? I make the joke all the time that I could have gone and started any company, right? I could have, and if I wanted to be like, the next Elon Musk or something, starting a healthcare cybersecurity business probably wasn't the path to the easiest riches. But for me, when I look around the security industry and I think, what do I want to spend my time doing? It's where can I make the best impact on human life? And securing a hospital is far more interesting to me than securing, a Bitcoin depository or something. To me, that fits with what drives me. The other side to it is, and Suchi had it right, there's a lot of just intellectual challenge that's really interesting in healthcare. Healthcare has a diversity of challenges that I haven't seen anywhere else. There's lots of networks that you don't have Windows 98 and Windows XP still in massive populations. That's not true in the hospitals, right? Almost every hospital you still find some of that. You'll definitely still find Windows 7 everywhere. Old Linux boxes, and then figuring out how to secure them, because you can't put any software on them because they're FDA regulated medical devices. So all the tools that you're used to having just aren't available to you. And as Suchi said, the opportunity to be creative is really there in healthcare, but you have to be willing to understand how they work, and you have to be willing to understand what they're up to. So whether you're mission oriented like me or not, and that's what drives me. But in a lot of situations, I think you could just find that it's a fascinating place to work too, right?
So, Mike, you brought up that example of Windows XP on all of the devices, and I know everyone probably is cringing in the audience. But can you sort of delve into that a little bit more about analyzing the business investment, the return on investment, and the risk? What is that sort of balance that you have to play being a security professional within healthcare?
So you have to realize that healthcare isn't one technology environment; it's three. It's traditional IT stuff, which looks a lot like what you get in anywhere, right? Like there's laptops and desktops and switches and routers in healthcare, just like there is everywhere else. Then there's the entire care delivery workflow, or clinical technologies. You often hear it called biomedical technologies. People like to call it the Internet of Medical Things, which I feel like is just too much marketing for me to actually use. But like all of that stuff is much like you see in any sort of operational technology environment. You have long life cycles for things, right? A top of the line CT scanner can cost anywhere from $8 to $15 million. Well, you're probably not replacing that every 3 years, right? If I'm going to go spend, 8 figures on a device, I'm expecting that device to last for 20 years. Well, think about it. If I built a computer in 2004, expecting that it would last until 2024, it's probably a Pentium 3, right, with a couple of, maybe a gig or two of RAM, and it's running Windows XP, and it might even be running Windows 2000. But that's still in use today because it's still a valid CT scanner, and and nobody expected to buy that and swap it out every 3 years. And so, the really interesting thing in healthcare, and I mentioned there's 3 environments. The third one is the electronic health record system, as Suchi was talking about, which is its own set of challenges, and we can talk about in some other time. But the idea that you're going to buy all this incredibly expensive equipment. I was talking to a CFO from a health system recently, and we were talking about his, and I quote, Windows XP problem. And he said, I have about $100 million of devices that are running Windows XP right now, and my security team says, we've got to replace them all. And I'm like, where am I going to get $100 million to replace all of these? Like, we don't make that much. Like, we're not that big a business. And you start to understand that this equipment has to stay in use, and that us as security people walking around going, that's Windows 7, you can't patch it, take it off our network, that's a good way to get yourself hated really fast as a healthcare security person.
So we touched on this a little bit earlier, and I'm going to turn the floor over to you, Suchi, as far as healthcare privacy. So we're unfortunately lumping, healthcare privacy in with healthcare information security, but I think that data records, the electronic records, understanding that there is so many different transfers of information between the payer, the provider, the patient. How do you navigate a career so that you are understanding healthcare privacy, but also becoming successful at it?
Yeah, I actually think the answer to that is going to be exactly the same as it was before, but there's some additional context there. In the healthcare field, you can't have a successful healthcare privacy program without a successful healthcare security counterpart. And I'll give you an example of why that's the case. A long time ago, when I was in private practice, there was a medical device. And the way the medical device works is that the doctor would say, hey, patient, you can go use this medical device. Here's the prescription for it. Here's the place you go. Here you pick it up. These medical devices were reused by patients. When they're done with their course of treatment, they would turn it back in. And for more context about medical devices, the companies that create these medical devices are not required to send updated software to the medical devices. So frequently you'll get something in 1999 or 2000 or whatever, and nobody does anything to it from a security perspective, regardless of all of the sensitive information, ever, right? So for me, that's a huge privacy problem, because here's what can happen, and this is what did happen. 3 of the patients patient number 1 used the device. Patient number 3 was able to see patient 2 and 1's information just by rolling up a little switch and clicking on that profile button. And that profile button had first name, last name, date of birth, and then all of the measurements. And I think it was like O2 measurements or something like that. So under HIPAA, which very specifically defines what creates an incident or a breach, it's risen to the level of a breach, that's a privacy problem. But it's also a security problem, because the security person could have looked at that and said, hey, maybe we should find a way to erase the data or wipe the data, or maybe we shouldn't be doing this at all. And it's that type of creativity, that creativity and awareness and ability to really work around these weird frameworks that you're stuck in, because the FDA isn't doing anything. There's a huge movement to get medical devices to be more regulated and to be more secure, but that's been in play for a while. So you, the security person or the privacy person, are stuck going, okay, what can I do to minimize this risk and make sure it's practical so I don't end up on the front page of the newspaper?
So Suchi, you bring up a really good point as far as regulations, and it's interesting that there are so many different security sort of careers that have some impact by regulation. So we have healthcare, we have finance, we have gambling, a few others. So in your creation of your career, how much time have you had to spend researching regulations, and how much of your time do you have to spend keeping up to date with that? Because obviously you didn't have to get a certification, but you do have to get a certification and understanding all the regulations all the time.
Yeah, it's like a second job, which might be kind of a scary concept. I have my day job. I also have several newsletters. I use Twitter pretty aggressively to get information, especially from the InfoSec, cybersecurity, incident response world. I'm always consuming information, and you have to do it because the landscape is changing so rapidly, and you want to be aware. So an example of that is ransomware was sort of a thing back when I was in private practice. And over the last 3.5 years, it has hit like some kind of like meth. I don't even know. It's a wild ride. All of the lawyers I know in cybersecurity in the healthcare space are really worried about ransomware because there have just been so many successful attacks. And so part of my job is going, okay, hey, I know this person who's doing a panel or doing some kind of webinar. So even though it's in the middle of my workday or after my work hours, or maybe even before my work hours, I need to show up for that. So I'm in the position to give the correct guidance to my privacy team or my legal team or my C-suite. And that's happened several times. Like there are several times where I'll see something on Twitter and I'll ping my security colleague and say, hey, did you see this come down, and does it affect us, and are you worried about it? And sometimes it's nothing, and other times it's been, yeah, we need to look into this. There was a bulletin that went out. Like that kind of constant awareness is absolutely necessary.
Awesome. So we've sort of painted this picture of the healthcare industry as, a creative challenge, one that has a mission component, if you would like to have it a mission component. I'd really like both of you to sort of point out what are some of the challenges you encountered that most people outside the industry wouldn't even consider. We've touched on several of those, but maybe recap those. Mike?
Yeah, and I think it's going to flow really well from the last one, because I think it's really important to understand that within healthcare especially, understanding the regulatory environment really helps you understand a lot of the technical decisions that are made within hospitals and understand a lot of the challenges that they face. To Suchi's point about the FDA has only had cybersecurity guidelines since 2014 for pre-market guidance and 2016 for post-market guidance. And the challenge for that in the industry is if you see how medical devices are designed and built, it takes about 5 years to get a medical device to market. So the devices that are coming to market now are the first ones that have ever been built with cybersecurity regulation. Everything that's on the market right now pretty much was built in a time that no cybersecurity requirements were required. When I got to GE, we hard-coded the root passwords to all of our Linux-based medical devices. You could not change them, and we printed them in the manual, and that was not legally a risk that we were doing so. In fact, it was accepted practice at the time. And so you walk into healthcare and you go, why is this all backwards? And why are all my root passwords for every device on my network printed on some PDF on a website? And then you figure out how to secure that, right? There's a lot of things that don't make sense until you actually immerse yourself into the healthcare ecosystem. The EHRs are my favorite example. You know, the medical device manufacturers are regulated and required to actually publish vulnerabilities and publish patches. The EHR vendors aren't. So one of the major EHR vendors put out 50 security updates last year. That same company has one CVE in the history of the company, which means there's not one security product on the planet that knows how to detect the vulnerabilities and exploitation against that massive product that is worth billions and billions of dollars and holds literally every health record in this nation, pretty much. And when you start to understand some of these challenges in the regulatory space and why some of the practices for certain parts of the software environment and the technology environment and why some of the practices in healthcare are the way they are, that's when you get to be creative. But the real challenge, Kathleen, to your question, is you've got to be willing to understand all of this stuff and really immerse yourself in it before it starts to make sense to you why things are done the way they are. And only then can you really change those things. And it can be a hard road, and it can be a frustrating road, especially if you are not willing to really examine yourself and examine your own practices and really think about why people are doing what they're doing.
So it actually sounds like you have to be a little bit humble to go into healthcare security. You know, a lot of us like being, you know, top of our game, and we like to know it all, but you even got someone to pull you aside to say, hey, you're not Mr. Know-It-All in this industry. You've got it all backwards. So Suchi, what are some of the challenges that, you know, you've pointed out some of them, but what are some of the other ones you think that people who are looking outside in would not even consider and that you encountered and you were able to work around?
Yeah, I think the big one is really, like, you know, and we've probably said this like 50 times already, but I'm going to echo it again. It's what Mike said. Like, you really have to understand the business itself and the structure. And as a privacy and cybersecurity lawyer in this field, that often means that I need to understand more of the corporate stuff or more of the marketing requirements or things like that before I can really give guidance, because all of those regulations also play in on the privacy and cybersecurity regulations. And so the best colleagues I've worked with, and most of the security folks I've worked with are amazing, but there's a difference between inter-level healthcare security and your management or senior management or your C-suite. And the best folks that I've worked with are the ones who can sit in a call and say, okay, you've given me a lot of new information. Here are the, you know, options that I'm thinking of, and here's what the risk looks like, and then are willing and able to take the feedback that they get from the other people sitting in the room who may have more in-depth background on the various things that they're weighing, and do it in a way that doesn't make them feel bad about the fact that they're maybe not the most up-to-date or they don't know that nuance, because you cannot know everything as one person in the healthcare security or the healthcare privacy field. Like, you have to be open to being wrong or, you know, just somewhat off or whatever it is. Like, you have to be able to have that patience and growth mindset. And if you do, the success is going to come so easily. And that's true for the junior healthcare security folks as well.
Well, we've had a really great conversation here. I'm really excited, you know, especially now as we're coming out of the pandemic and people are really looking at healthcare in a variety of different ways, that we've been able to introduce this topic here at BSides Las Vegas 2021 Higher Ground. I wanted to ask both of our panelists, what are your final career recommendations for our audience and I would like this in two classes. For the first is someone who is just new to information security and is considering a new career path, and then someone who is an experienced information security professional but would like to switch careers into healthcare. So Suchi, kick it off.
Yeah, so for both, it would be to get that HIMSS membership. If you're already experienced, get it sponsored by your company if possible, and show up and listen or be part of the problem solving. So that's the first one. I think the second one is for the folks who are new, don't hesitate to ask folks you know in healthcare security for what their playbooks look like, because that's information that can be shared in healthcare security without any real restrictions. And then for folks who are experienced, I think it's, if you're trying to transition from an experienced position in InfoSec to healthcare InfoSec, it's really diving into what is the difference and why is it so important? And again, that's focusing on what is HIPAA and how does the healthcare industry work?
Mike?
So I think there's two parts to this, and I'm going to give a blanket thing before I split it the way that you were thinking, Kathleen, which is there's two things that we haven't covered a lot of today, which is we've been sort of talking as though provider systems and hospitals and the like are kind of the end all be all of healthcare, but we're in a really exciting time for healthcare as well. There was more venture capital investment in health tech startups last year than in all the previous years combined, as far as I remember. The statistic is something like that. Suchi works at a health tech company right now. Scope is a health tech company. We are not a traditional hospital, but there are a lot of ways to work in healthcare that aren't necessarily the same as working in a hospital itself. That said, I think working in the actual health delivery organizations is really fascinating, especially as an early career person. I've always recommended to people early in their career to find jobs that are going to be very expansive, that are going to require you to learn a lot of different things, that are going to require you to be on diverse teams, rather than working on this massive team where I do the same task over and over and over again, for 18 months. And then add one more task 18 months down the road. Like, I think that one of the best ways to grow early in your career is to take a job where you're asked to do a little bit of everything across the entire environment. And that is the definition of every hospital security team I've ever seen, right? You are working in architecture, you're working in vuln management, you're working in policy, you're working in incident response, you're doing all of it. And so early in your career, and especially early in your career, the hospitals and health systems can't get enough early career people to come take those jobs. Great place to go work, great job to go do, great things to learn. Later in your career, we talked a little bit about the mission orientation, but especially to Suchi's point about how cohesive the executive teams tend to be and how interdependent everyone is, because I don't know very many security people who are also medical doctors who understand what all of the execs around a table understand. Whereas, in lots of other jobs, security people, like when I was at Lookout, my security skills and my tech skills were similar to a lot of the executives around the table. That's very different than in healthcare, right? The other executives have totally different skill sets. And so if you want to work in an interdependent way where you have a really strong team and you get to rely on other people and not have to kind of be the smartest person in the room, healthcare is a really great place to do that. As long as, to Kathleen's point, you're humble enough to do it.
Well, thank you. Suchi, Mike, thank you so much for joining me for this conversation. I really wanted to enhance Higher Ground this year, to delve deeper into specific career tracks for information security professionals, and you both provided an excellent conversation. Thank you so much, and thank you to all. So good evening and welcome to our last panel of Higher Ground. It has been so exciting for me to bring these panels to Higher Ground because we all know that security is fascinating and we know that we are protecting so many different assets. But one thing that we haven't been able to explore through any of the cons is the various different industry silos, industry paths that people can take. We explored earlier about the finance security panel, and I really appreciate all of those panelists coming together. Right now, we're talking with two of my friends, Suchi Pahi and Mike Murray, who not only are fellow security professionals, but also fellow drinking professionals. So our first question, red wine for most of us. So anyway, our first question that we have from the audience is, many healthcare delivery organizations need this mashup of skills between cybersecurity and healthcare. Do these organizations know they need this? How can they find the appropriate people? This seems like a recruiting problem that's worse than many other cybersec specialties. So, Mike, I'm going to have you address this question because we have another question coming through for Suchi. So,
okay.
Mike?
So yeah, this is one of those yes and kind of questions, because I think it's a true statement that you need both those skill sets. I don't think it's very different than anywhere, right? I think, and you watch talks about security careers, whether at BSides or anywhere, and somebody on stage is bound to say that you have to understand the business you're in order to protect it. That is 100% true in healthcare, just like it's true in financial services or, oil refining or anything else. I don't think most people get that experience by learning it before they get there, though. I learned about healthcare when I started working in healthcare, and it became a bit of a crash course in healthcare. And I've spent the last 10 years, completing that crash course. Although it's not complete, I learned about healthcare every day. But I think you don't necessarily have to have it coming in. You just have to realize that you're going to have to understand the business you're in, no matter what that business is, and you have to commit yourself to learning about it.
Well, I also think that, to the question, so many of the healthcare organizations are really more geared toward hiring the right medical and nursing staff. That is their service delivery system. And so most of the recruiters who are working in those organizations are doctor recruiters or physician specialties or nursing. And that is a much more specialized recruiting than recruiting for security professionals. And you're asking recruiters in a healthcare organization to do both physician recruiting and security recruiting at the same time. So this is something that's evolving. That's, I think, going to be the problem when candidates who are looking for this kind of career, that they have to be patient with the recruiters to understand that the recruiters may not be as trained in security specialties as they are trained in, determining the right neurosurgeon or the right, physician's assistant. The second question that we have for Suchi is, what job roles are available for people who are interested in healthcare policy but aren't necessarily lawyers? And how can you find the right organization to be part of if you want to be part of healthcare privacy or policy?
Yeah, actually, I love this question because we would love more tech folks who are comfortable and I guess I'm going to say agile. I know it's a buzzword with various technical concepts and able to actually write or learn how to write or do research and things like that in the health policy field. Because honestly, like as a lawyer, I can learn and do a lot, but I really enjoy being able to learn from someone or work with someone who knows the area like on the ground, basically. And so if you're interested in doing health policy, whether or not you have a master's degree or something like that, you can look at organizations like the Center for Democracy and Technology. They used to have a great health privacy project. I don't know if they still have it, but organizations like that, they're a nonprofit based out of DC, and they tend to take people for fellowships. They're looking for folks who are technical, who want to learn how to be leaders in the space, and then they'll let you do your thing and connect you with the other people that are really important within the government, so you can be a policy specialist that way. You can also go work with a senator or a congressperson and influence policy that way. I cannot remember his name Ron Wyden has technical specialists on his staff, and he's incredible when it comes to dealing with technology in Congress. And so if you go work with someone like that, you're really opening your own doors into the health policy and privacy space.
Wonderful. So another question that we have is, what does the opportunity look like for security researchers in healthcare these days, particularly regarding product security, embedded device testing? So Mike, this sounds like something more that you did at GE Healthcare as far as dealing with product development. And so not only what does that sort of career path look like, and what would be a really great way to break into it?
Yeah, so let's start with there's actually somebody that I know who's hiring for security researchers right now in the space, and that's Mitch Parker from Indiana. He actually has just started a red teaming lab to do security research on medical devices that come into his health system. And you're seeing more of that kind of thing. The product security orgs, it's really funny that it's really hard to find people. Like I know all the medical device manufacturers are really struggling to find people that can actually do that work. And there's a little bit of, it's not really traditional security research. It's kind of halfway between security research and very traditional security architecture, because you have to be willing to work at the speed of medical device manufacturers, and so the kind of move fast and break things, hey, let's just blow things up kind of ethos doesn't usually play as well. And so you have to modulate that if you want to work in that space. As far as healthcare delivery actually having security research, other than Mitch and maybe Mayo Clinic and maybe Kaiser, I don't think there's anybody that's really doing a lot of that kind of work. And then the other thing I would say is there's companies like us. There's a bunch of startups in the space, whether in the sort of like network firewall-y kind of IoT solutions like Medigate, or that list is 50 million things long. Medigate, CyberMDX, Order, Zingbox. I'm leaving out a whole bunch of them. I don't want to offend anybody, but just all of those companies are looking for people. Us at Scope, we're always looking for folks like that. My friend Dan Dodson runs a company called Fortified Health Security that is an MSSP that does a lot of pen test type stuff and some security research out of Nashville. Like, there's companies that do this. You just have to, they're not the traditional security companies. You got to go find us. But we're out there.
So on the hiring side, what do you think is sort of the unconventional or hidden skill or talent that you think is important for someone to look for when they're hiring in healthcare infosec? So, when I think of this question, I think of our discussion about this topic and how it was very mission oriented. So it almost seems like I would think being able to go beyond yourself and wanting to give back, because you both seem to be interested in the greater good or the higher purpose, because we are talking about people's lives. But what are some of the other existential hacker skills that people would need in healthcare security? Suchi?
I would start with, I think, the ability to understand nuance and contextualize the feedback that you're giving other people who aren't in security. So I want someone who can gather information and then give me like the nitpicky details and say, hey, it's maybe not a data breach because of XYZ, or maybe never use the word breach at all, and then explore that with me as the counsel or the privacy officer.
Mike?
So I'll throw in. So completely agree on all of that. I'm going to go left turn, as I usually often do, and say I think one of the two sides but the same skill, just different sides of it. One is patience, and the other is the willingness to be flexible, because healthcare is its own business. It is its own environment. It's its own politics. It's its own org structures. It's a lot of learning for people who came up. If you went and got an InfoSec degree, like a lot of the things we do in our industry have really been formed by financial services, right? From the structures of our sort of hypothetical orgs, and a lot of the things we do in many of our compliance standards and stuff, it came from SOC 2, or it came from some of these very financial services kinds of ways of working. Healthcare works differently. And if you're going to walk in and try to be dogmatic, and if you're going to walk in and try and change them, you're going to lose. So you have to be patient, and you have to be willing to learn that you don't actually know how healthcare works until you go learn how healthcare works. And
well, I want to interrupt and say, something you said in your presentation was, understanding that you can't just go in and patch $100 million worth of equipment. We're so used to being able to go in and deploy patches or fixes or something like that. And this is very similar to the defense industry. You have to be able to, in the defense industry, work on technology that's maybe 15 to 20 years old because it's legacy and that's what everyone's on, and you can't just change it. So I think that would be another skill, is that having that angst of like, why can't I just deploy this one script and fix everything?
Yeah, that's what I mean by patience, right? Like you have to be willing to learn why these things that are inefficient are inefficient. And like defense is a really good example, Kathleen. Like look, I can't go work in defense. I don't know how those people think at all. My brain doesn't work like that. And it would take me years of learning to go work at a defense contractor, right? But people think they can go into healthcare and like, oh, well, I know that HIPAA, I know how to spell HIPAA, so I'm good. Right, it doesn't work like that. There's a lot of work. You have to be willing to sort of be the sort of open and what do the Zen Buddhists call it? The beginner's mind kind of student. You have to go in and realize you don't have a clue for at least the first year. And I started this journey of learning healthcare in 2013, and I still don't have a clue most of the time. So. And that might just be me, but at the same time, like, you know, it takes a long time and there's a lot to learn.
It really does. So we're going to wrap up here. Suchi, any final thoughts to tell people to inspire them to be part of healthcare, privacy and policy? And I'm going to give you another different question, Mike.
I would love to see more people in this space. So if you're interested and you have questions, obviously reach out to me or Mike. There are a lot of people participating in BSides Las Vegas who are healthcare oriented. So, and HIPAA is spelled with 1 P and 2 A, y'all.
I love the Texas y'all in there. That's really good on y'all. So Mike, breaking and fixing and making new products in healthcare, how does someone bring their security mindset to that?
Ooh, so, damn, that's a hard one, Kathleen. Hard to be a wrap-up question. I can talk about that for an hour. First thing I'll say, actually, I'll plug something. Come to the Biohacking Village at DEF CON, because they set up, and actually this year's weird, but we're still doing it. But usually there are medical devices there that are eminently hackable, and it's always fun to hack the new stuff that the medical device manufacturers bring. But just reach out, like Suchi said, just reach out, come talk to all of us, like, you know, and talk to other people who are in this space. Sushi Dude, who's on Twitter and who's been asking questions here, has been working in the healthcare stuff for a while. Like there's lots of us that do this. I mentioned Mitch Parker earlier. You know, like there are many of us out there. Come approach us. We're nice. We don't bite fingers off when approached. And you know, like, just come say hi. I will give whatever advice I can. And if I can't help, I probably have friends like the two of you and all the other cool people who are watching this that maybe I can introduce them to. So yeah, come hang out, and that's the best way.
Wonderful. Suchi, Mike, thank you so much for sharing your strategy, your careers, your experience. And I know you've made Higher Ground always just a wonderful place to be. So thank you, and good night, everyone from Higher Ground at BSides Las Vegas. Take care. Bye-bye. Good night.